Hello, everyone. I hope you can hear me. It's Jennifer Freiheit, the Director of Health for the Kenosha County Division of Health, with our third week of Let's Talk COVID. Just wanted to go through the numbers first, and then there are a number of updates and questions that I will answer for you. So as of 2 o'clock today, we were at 42 positives. And since 2 o'clock, we jumped up to 55 or 56 positives. And I say about 55 or 56 because it was a flurry of activity since 2 o'clock, and the crew is still trying to put everything into the database and make sure we have our numbers exactly right and dot our I's and cross our T's. So today was an intense day for the health department. We have 12 public health nurses working on what we're calling our positive team in our incident command structure. And these 12 public health nurses are working 7 days a week to manage the positive cases. So big jump today, up to about 55 or 56. We have had since the beginning, the total number of positive cases who have required hospitalization has been 5. And I apologize, I don't have a breakdown for you right now as to how many have been released from hospitalization and who still is currently hospitalized. But I do just want to take a moment because to send good prayers and good thoughts to the families and the people that are hospitalized right now for COVID. They're going through a tough time. It is not an easy process, but we're hearing amazing reports from the nurses and doctors at both hospitals and how they're really bringing these people back. Many of these have been intubated, and so we just, for example, 5 minutes ago, I heard good word that one of them is now sitting up in a recliner and will hopefully be able to breathe on their own in the next couple of days. So please keep sending your prayers and thoughts to those that are hospitalized and their families, as well as everybody else who's dealing with this. Of our probable cases, this is a new reporting category. We have 14 probables. This is a really hard number to track, but we're attempting to put some semblance of numbers to them. A probable would be, let's say there's a positive contact in a house, and for example, their spouse might also be experiencing the exact same symptoms, but they have not been tested, or maybe they can't get tested. And we are now putting them in isolation orders, just like we do our positive cases, and we're counting them as probables. So I can foresee this number is going to continue to grow. It's just simply hard to track because you never know if somebody's a probable or not, unless it's really abundantly clear that their symptoms are similar, that they've been a real close contact. We have had 495 cases. This was as of 2 p.m. Negative cases, sorry, 495 negative cases. We have 225 tests pending, and part of the issue is that some of these come through from like the private labs all at once. So they'll import 40, 50, 60 labs all at once, and that's sort of what resulted in today that we're scrambling with all of these positives that came through at one time. We have only 68 people under contact investigation right now, and that is because that number you will notice is lower from last week because our contact investigation team actually has 23 people on it. So we ramped up the number of people on the contact investigation team because that number was quickly growing out of control. Because of the number of people trained and now doing contact investigations, we only have 68 people we're following. I suspect this number will jump greatly tomorrow as we work through the recent positives from today. And 232 cases have been closed and sent to the state. So just for a little bit of number reference of our positives, and granted this was as of 2 p.m., only 66% of our positive cases have ever had a cough. So, you know, you hear on the news and you see from CDC website and whatnot that cough and fever, one of the main symptoms, but only 2/3 of our positives in Kenosha County have had a cough. Just over half have had a fever, 53% have had a fever. And 22% of our positives in Kenosha County as of 2 p.m. had no symptoms whatsoever. So just under a quarter of our positives, now this is the very small subset of the population who's even been lucky enough to get a test, have had no symptoms whatsoever. I have received many questions as to why workplaces, grocery stores are not doing temperature scans for everybody that enters. And this is the exact reason why, that only half of the people have a fever of the positive cases. So it is not a foolproof one-stop shop answer to be able to take temperature scans, although it is very good practice. Early on, before we ever even had a positive case, we were putting out the recommendation and guidelines that workplaces should require temperatures. Right now, for example, I know Aurora Hospital has closed all of their entrances except for one or two, and they're taking temperatures of everyone that enters. EMTs, they don't allow visitors anymore, but any of the workers. I mean, so this is good practice to have a temperature scan, but it is not the end-all be-all answer to basically mitigating this virus. I did want to jump to the Strategic National Stockpile and the materials that are coming from it. We just received word that several deliveries occurred today and have been since Sunday, and it appears that several more of our long-term care facilities will be getting some PPE relatively soon. And as soon as I have those numbers firmed up, we'll let you know. I also spoke with the Kenosha Cares group today, the faith-based leaders in the county who are doing some amazing work trying to assemble more resources and help out with getting all of the PPE that is necessary for all of our first responders and healthcare partners. And so there's lots of good work going on in the county. So many amazing people making donations and offers to try to help this situation. Which brings me to another numbers question. I've received several questions of how many ventilators do our hospitals have and are we prepared? And that is a very hard question to answer because our hospitals are part of larger systems. So, you know, Freiheit and South and Aurora are both part of larger systems, in which case they will move ventilators to where they're needed. That doesn't mean they will strip one hospital of all their ventilators because, let's say, Freiheit in Milwaukee needs them all. They will adjust as the need arises, but right now the ventilators that we have are working and sufficing. We have plenty within Kenosha County, but I will assure you that both hospital systems right now are literally working on their modeling needs, what the projected need may be, and they're working on ways to procure that so that they can have an extra stockpile should we hit that peak of hospital resources and that they need as much as they can get. So this is also part of a big, broader national talk I'm sure you've heard about on the news. But as of right now, our hospitals are competent with the number of vents they have, and they are being used, and they are sufficing for the number of hospitalized cases that we have right now. I did want to address this week has been full of a lot of rumors, people reporting to their workplaces that they have COVID, that they've been positive, and maybe they're not. Maybe there's confusion around people we have called who are close contacts to a positive. So we're putting them in quarantine. So because they have come in contact with a positive, we don't state the name of the person who they were in contact with. Sometimes this is known because maybe the friend or the coworker or whoever texted all of their friends to say, hey, I'm a positive. I just wanted to let you know because we had lunch last week or whatever it might be. We don't disclose that protected health information from the health department, but we're certainly receiving a number of calls from workplaces who want letters to prove that their employee that called in is indeed a close contact or a positive. And these requests are becoming increasingly time constraining for us to be able to handle the number of rumors and stories that are out there. So I would request that workplaces try to be as forgiving as possible and to be able to allow the healthcare workers to do what they need to do and put people in quarantine that need to be in quarantine. Let me see. I have a number of other updates. The county is developing a COVID-19 dashboard, a sort of resource hub, new website, and that will go live this week. People have been asking for more detailed information, a breakdown of cases, and now that we have more positive cases, we can certainly be able to show the age range from 7 to 87 and in what age groups, the general census tract that, oh, I see several questions just came in. I'll get to those in just a minute. The general census tract where positive cases have been found as non-identifying as we can make that. So there'll be more information that will be coming up soon this week on a website that will be widely advertised and that we're excited to share with that. The Institute for Health Metrics and Evaluation has also developed a COVID-19 projection webpage. Some of you may have seen this, and this is to sort of determine when the resource peak is for each state. So you can see the United States in general, and you can see Wisconsin and Illinois and every other state. What this is, these are some top epidemiologic researchers who are trying to do some predictive modeling using epidemiological science to predict based upon when states went into a shelter in place versus whatever social distancing measures they put in, the number of positive cases they have right now. And they put all of this together into some algorithms to basically try to figure out when the peak would be. This is the best we have to go on at this time, and it shows that Wisconsin will not hit its resource peak until April 27th. So resource peak meaning at what point will the hospitals be completely full and inundated? April 27th is what the best guess we have at this point for Wisconsin. The peak resource for the rest of the country is April 15th. For Illinois, it's April 16th. So as we have been, Wisconsin, a little bit farther behind the rest of the country with regard to the number of cases and all of that, so is this peak. And that is just something that gives us some idea of when things might start to begin to slow down a little bit for us. Another thing is that the state of Wisconsin will be making an application to FEMA for a major disaster declaration to include individual assistance for crisis counseling. So just so you know, more is to come on this, but we know that this whole disaster will result in the need for increased emotional and mental health resources, and so the state is looking at that. And I will jump to some of the questions that I already received, and then I'll look at Evan's email for the last minute questions that just came in. So the first question I have is, has the health department's case investigations developed threads of infection that have led to others testing positive? And so this is what we call epi-linking. We use the science of epidemiology to link cases. And yes, there have been some where we are seeing small clusters who maybe were all at the same location at the same time. And that is part of what happened today, is that it increased our numbers because of this tight group of people that then possibly infected each other. So we are able to identify many clusters. We literally have not had the time, though, to be able to truly do a demographic analysis of those testing positive and be able to pull all that data together, because we're really just keeping up with the numbers as we go through right now. This will be fascinating at the end of all this to epidemiologically look at all of our positive cases and the signs and symptoms and the things that occurred and when they occurred, to be able to sort of say, you know, how this blew up and what happened and what we can do better for any future communicable disease outbreak. So we are beginning, the second question I have is, have you done a demographic analysis of those testing positive? We are beginning to look at that, and that is some of the things we will share on the new county website. Just minor demographics that will appeal broadly to the public. So that will be coming. Has the testing backlog at the labs cleared up? From what I'm hearing, the labs are keeping up, but that is only because they're still monitoring in those tiered who's allowed to get a lab test at the State Lab of Hygiene and the Milwaukee Health Department lab based upon those tiers. So it sounds like they are able to keep up. They're certainly getting test results back to us in a timely fashion. The private labs are sort of bulk uploading at one time. Private labs are taking a little bit longer to get test results back to us, so I can't attest to whether that's a backlog or just how their processes are, but we are indeed getting the lab information back. Do you envision tests spreading beyond the 2 tiers that have been in place anytime soon? I have no answer for this. We would hope, but that also isn't in line when and if we will get more tests. So if more testing becomes available, then the labs will certainly have to figure that out and work beyond the 2 tiers. What do you know about the new Abbott test? Will the test be available anytime soon here? If you're discussing about the 5-minute COVID testing, it is already available at our Aurora hospital. And I haven't been able to ascertain if it's anywhere else in Kenosha County yet, but we don't know about any false positives with this, but it is already in Kenosha County, and hopefully soon it will be much more widespread. That was just in the last, just within the last week that occurred. Are you satisfied with the Safer at Home compliance in Kenosha County? I think we certainly needed the Safer at Home, and anytime there is something that maybe the Safer at Home order does not address, we're trying to then piggyback off of that to put in different social distancing measures or different media or messages that we want to enforce. So for example, on our Kenosha County Division of Health Facebook page the other day, we just posted that a trip to Walmart should not be a family trip. One person should go to do the grocery shopping, that we want to keep as many people out of the public as possible. We also just recently put out an order for long-term care facilities, hospice agencies who have staff that work amongst several facilities. We're trying very hard to minimize spread for especially the over 60 population, that we don't have staff hopping from one facility to the next. This creates a significant hardship for the staff of these long-term care facilities, assisted living, hospice, but we're sort of in the desperate times for desperate measures situation where we need to begin to think about limiting staff working at multiple facilities to potentially limit the spread. So these are some of the things we're adding on to the Safer at Home order from the state. Are any plans in place for dealing with outbreaks that might occur in the jail or at the Shalom Center? And this is definitely, both of these two facilities were ahead of the game way before we had any positives, implementing social distancing, putting things in place in their facilities, taking temperatures, social distancing, disinfecting, doing all of this. So they are definitely working on that, and should a positive occur in one of these facilities, we would immediately jump to action and do our best to mitigate the spread within those facilities as much as possible, much similar like we're doing at any workplace, or we would do at any long-term care facility or hospital. So Lake County has had confirmed cases at some 10 long-term care facilities. Has anyone tested positive at a long-term care facility in Kenosha County? As of 2 o'clock this afternoon, the answer is no, but we're closely monitoring that and keeping an eye on that. And anybody who's even been a close contact to anybody working at a long-term care facility, we're taking extra precaution and measures to quarantine them as well too. All right, let me look to see. Evan had texted me, or let's see. Oh, sent to my email. Let me glance in my email here with the additional questions that I received. Sorry, just a minute here. Why would someone without symptoms get tested, as just mentioned? So this is the million-dollar question that, you know, maybe somebody's provider, they were lucky and their provider suggested that they could get tested. You know, from the very beginning, the Centers for Disease Control had suggested it's a provider's discretion as to whether they would test people or not. And some are screening, some maybe just testing, some deciding not to test at all. So it could be luck of the draw that some people were able to get a test even though they're asymptomatic, or it could be that they're a close contact or a spouse or maybe a first responder or a healthcare worker who came in close contact with a positive and is asymptomatic, but they went ahead and were able to get the test. So it could be any one of those scenarios that somebody might have gotten the test without having any symptoms. And I see another question came through here. I'm hearing of other communities conducting blood testing to check for antibodies. Is this something that has been talked about? We had one request. We talked to the blood center, and I am not sure in southeastern Wisconsin the current status of this, but this is something we can currently look into because we have received the question of, can people who have already recovered from COVID then, you know, be part of this larger FDA study, I'm assuming is what you've probably heard about. And we'll definitely put that in our FAQ to see if we can get some more information about that. Do you think that giving our first responders a heads up regarding a COVID-19 positive test at a specific address that they are called to would be an added safety precaution for them with the shortage of PPEs? So this was a very big discussion this week, that sharing of the positive addresses with our 911 dispatch, in that it certainly is one of many tools. Our caution is that very few people are tested. So to just have the addresses of those tested positive might lead to a false sense of security, that because it is widespread throughout the community, we have community spread, it can be assumed that almost anyone at any address, that the first responders should be wearing personal protective equipment. So we want to make sure we're using all the tools in the toolbox, but that we're also being as protective and careful as possible. And let me see here. Let's see. How are ambulances being cleaned, and what can we do to help situations, like the attached example? That is a question that I don't have an answer to. I know that they're meticulous even before COVID times with cleaning and disinfecting. So we can certainly come back to an answer as to how they are cleaning. All right, next question. How many are being tested daily? Waiting list? Have we gone to shelters to test anyone? So as of right now, it's hard to say how many are being tested daily, because both Aurora and Freiheit are testing by appointment only. And so that is basically how they're operating. I do not know if there is a waiting list. Surely there are many people who are wanting to get tested, but they're being screened out because of that new tiered testing. So the waiting list question is pretty subjective. And then, have we gone to shelters to test anyone? At this time, there is no mobile testing capability. So there hasn't been any going out of testing anyone elsewhere outside of a provider's office or the hospital systems. And I think, unless I missed something, unless I missed anything, I think that is the last question. I'll just check in with Evan here over text. He said I got them all. So thank you for listening again tonight, and we continue to need your prayers and support for mitigating this pandemic, and to keep those that are ill, and especially the hospitalized, in our thoughts, and to do what we can to help minimize the threat for those, especially of our frontline first responders and healthcare workers. So thank you very much, and I look forward to talking to you next week.